Well, good afternoon or good morning to everyone who's joined us for this webinar this afternoon. I'm Terrell Eisinger. I'm the Executive Director of the National Organization of State Offices of Rural Health. As you've just seen, we're celebrating the 25th anniversary of the State Office of Rural Health federal program this year, and we're very happy to be able to laud the efforts of the State Offices of Rural Health. It was a State Office of Rural Health Director, Karen Madden from the state of New York, who first said the words National Rural Health Day. And so, like many good things, they start with the state office with a quiet voice, and they grow from there with the work of our partners. So you saw in that opening slide, we have many partners and sponsors that we're thankful to for support of this day, particularly our friends who are on the call today from the National Rural Health Association and Hall Render Associates. National Rural Health Day is a day to honor the good work of providers and communities across the nation as we try to improve the health and health care for rural people in small towns and from small facilities. So I hope that you are enjoying the effort today and the celebration. As we begin, I'll remind you that this work doesn't get done without hard work from our staff as well. I want to take a moment to thank Ashley Munninger, who's our Communication and Development Coordinator, who's done a lot of great work with our social media and our webinar. I also want to thank Matt Stricker, our Special Projects Coordinator, who has taken on the task of coordinating the webinars today, and to Cassie Clark, who did the great work of putting together a Community Stars book that highlights rural people and the good work that they're doing. So thanks to the whole NOSOR team, but especially those three. As we begin, you will find that your phone is on mute, and we hope that you will use the chat box in the upper right-hand screen of the webinar screen for your questions for the speakers. And I can tell you that you're in good hands for the next 30 minutes with Andrew Coates, who serves as NOSOR's legislative liaison and works closely with Hall Render and Liberty Partners Group, and Maggie Ilanaway, who's the Government Affairs and Policy Vice President for the National Rural Health Association. This topic is so important today because as we move forward to advance the concerns of rural communities, we must stay in close step with all of our partners. And certainly NOSOR's work with NRHA is one of our most important priorities. So thanks both to Andrew and to Maggie for joining us today. And Andrew, I believe that you're going to lead us off.
Great. Thank you, Terrell. And happy National Rural Health Day to everyone who is tuning into this. Appreciate you guys coming aboard and listening to us today. I think the timing on National Rural Health Day couldn't come at a better time. Here we are in the shadow of last Tuesday night's election, and just seeing the renewed emphasis that's being placed on rural America and rural health. And I think, you know, if you glance through the newspaper articles, if you glance through Twitter, you can see that this is an offshoot of the election results and the role that rural America played last Tuesday. I know every year we send out a blast email to the health LAs in both the Senate and the House, asking their bosses to promote the power of rural. And in last year at least, we had a lukewarm response. But this year, just seeing the outpouring of tweets that have come from senators, congressmen, talking about rural health has been really, really awesome. And it shows, I think, the effect of Tuesday night's vote. I want to touch briefly on the implications of the elections and what that's going to mean for rural health, both in kind of the direction Congress is going to go between now and the end of the year, and then next year and the beginning of next Congress. I think, to almost everyone's surprise, Trump won last Tuesday night, and in no small part, that was due to his ability to run up a lot of rural votes in states like Wisconsin, Michigan, Pennsylvania, states where Republicans have not won, or Republican candidate has not won in a long time. And the numbers are starting to flow in the outpouring of votes from rural counties in particular, and even in states where Trump lost or ran very close, like New Mexico, Arizona, Nevada, Colorado, we're seeing numbers that no candidate, Republican or Democrat, have received in decades. And I think this speaks to a couple things. One, obviously, Mr. Trump was able to tap into a sentiment of voters, and he very effectively did that. But two, I think rural America for years has felt, maybe not just from the administration, but also from Congress, felt a little bit ignored and like their voice has not been heard. And that may contribute to the outpouring of votes we saw last Tuesday. So again, I think that's a positive sign for rural health. The Senate also was a big surprise. Pundits who get paid, make their living kind of trying to predict the outcome of elections, even up until a couple weeks ago, were pretty firm that the Senate was going to flip to the Democrats. Republicans had a very difficult map to defend. Remember that 6 years prior to this year, a lot of members got elected who may otherwise not have been, thanks to the ACA vote and the strong reaction against that ACA vote. And states like New Hampshire, Wisconsin, Illinois, Ohio, Republicans had a difficult map to defend last Tuesday, and they only lost 2 seats. So the majority, they retained the majority, and it's now 52 to 48. One interesting note, there was no ticket splitting on last Tuesday. If the state went for Trump, so went the Senate vote. And if the state went against Trump, like in New Hampshire, in Colorado, Illinois, the senator there also lost. So we have a Republican Senate by a 52-48 majority. And on the House side, this was not a surprise. The Democrats were able to pick off 7 seats to take the Republican majority down to 240 to 195. But the way redistricting works right now, it's just you get a lot of members that are entrenched, and there just weren't a whole lot of swing districts at play here. So to no one's shock, the Republicans control the House as well. So, it was a big night for Republicans, there's no doubt. But the Republican Party needs to be mindful that this vote, it didn't come on the heels of your father's Republican platform or your older brother's Republican platform. Trump ran on a very populist message. And, while he and his administration are certainly going to be very conservative in some areas, border control, repealing the ACA, there's other areas like infrastructure spending, not cutting Medicare, Social Security, where he's going to be a little bit more to the left than your typical member in Congress or your typical Republican voter. So, so it'll be interesting to see how that divide plays out. So 2017, what's ahead now? What's next for Congress? On Monday, we entered the quote-unquote lame duck session, and this is going to run between now and scheduled to run between now and December 16th, although I see them getting out earlier. And it's really the only big must-do item they have this year is funding the government. So any programs funded by HHS, CDC, HRSA, FDA, they need to be funded. Funding runs out on December 9th. Remember, originally it was scheduled to, the fiscal year ended September 30th. Congress extended that through the elections. And one of the first big questions facing the Trump administration was Majority Leader McConnell, Speaker Paul Ryan went to the administration and said, what do you want us to do with the funding bill? We can pass this right now so you can start fresh next year. And that was the kind of the common line of thinking. But to everyone's surprise, the administration, or the Trump administration, wants to tackle that bill early next year. That's not typically a bill you see a new president take up in his first 100 days, an appropriations bill, particularly a Republican president, but they want to do that. So we're going to have two spending bills. Congress will have two spending bills that they have to handle next year. All indications are the House and Senate will pass a continuing resolution through March 31st of 2017, at which time, so next March, they're going to have to pass this appropriations bill package. And then they'll have the annual appropriations bill ending September 30th. So the appropriations will be at the forefront of the discussion next year. The first 100 days, you're going to have the rollout of the cabinet, the Supreme Court nomination right out of the bat. And the big one's the ACA, Affordable Care Act. Obviously, Trump ran on gutting the ACA. That's been the big question that we've gotten more than anything else. What is going to happen? What's the timeline? Maggie's going to get into the detail on this. But I guess if I could give one kind of word of advice, it would be that this is not something that's going to happen tomorrow. I know Trump had made a lot of claims of doing a special session of Congress and repealing this the first day he takes office. I don't see how that happens. This is going to have to move through budget reconciliation. That process requires the House and Senate to pass a budget resolution, and that takes time. I think at the earliest you see some parts of the ACA repealed could be, maybe next year around this time, and that doesn't even deal with the question of how they replace it. So that's going to be one of the major questions moving forward, is how they tackle the ACA. Flip this slide here. So there's a nice little slide. You see the green is the must-dos, the funding, leadership elections, which are already taking place. You expect the same leadership to come back. Maybe in the Democrat House, Pelosi, they may bring in a new leader to replace Pelosi, but otherwise expect the same leadership back. Any possible bills that might move in the next couple of weeks. Mental health, there's a comprehensive mental health reform bill, and the 21st Century Cures Act. Both are near the finish line. Both could be packaged together, although I'd still give it less than 50% odds that moves. You see the key dynamics in 17, and I won't touch much on this. But, how are the losing party of the White House race always has some internal battles going on next year. How will that play out? How will the Tea Party and the establishment Republicans work together? That's going to be a big issue in next Congress. I want to touch briefly on bills that in the 114th Congress that we've worked with members on that we're very supportive of and are looking forward to working with them next year. One, H.R. 5133, the Rural Hospital Enhancement and Long-Term Health Act. This was introduced by Representative Crescent Hardy out of Nevada, who actually lost his reelection bid. He was one of the few Republicans who did lose. But there were 10 or 11 co-sponsors on that bill, and we are working with those co-sponsors, and hopefully, and we're confident that one of them will kind of take the ball and run and reintroduce this bill next year. Senator Franken has been a longtime champion of rural health, and he introduced a package this summer of a comprehensive package of rural health bills. It touches on just about every aspect of rural health. S3189, S3190, S3191. I encourage you guys to take a look at that package. It will be reintroduced next year. I know their staff plans on reintroducing more of just a big comprehensive bill instead of 3 separate bills next year. And they're taking suggestions right now as to what should be included, what folks like of the current bills, what they don't like. So strongly encourage you guys to reach out to their office or to us or NRHA if you have questions or concerns on that. S3435 is the Our Hope bill, and obviously Maggie can talk about that bill in depth. That is, Senator Roberts introduced that, and Roberts and Franken are 2 of the champions on rural health in the Senate. They head up the Rural Health Caucus, and we can't thank them enough for their leadership. And then the House Labor HHS Appropriations Bill, and that's, again, what I talked about earlier and how Congress is going to have to deal with that early next year. NOSOR is very supportive of the House bill, which increases funding for state offices of rural health by $1 million. The Senate bill keeps it at level funding. So hopefully when the House and Senate negotiators meet, they stick to the House level. So that's kind of just a very general overview of what's next in Washington and what we see coming down the pike. I'm going to turn it over to Maggie now and let her talk you through what NRHA is doing.
Thank you so much, Andrew, and happy National Rural Health Day. And NRHA really wants to congratulate NOSOR for just another incredibly successful Rural Health Day. What I want to do is really follow up on Andrew's great presentation, highlight a couple of issues that NRHA feels important around the election and how we can amplify that in the new Congress and really make rural's voice even louder. He talked about the highlights and how it was a big GOP night, much to everybody's surprise, inside the Beltway last Tuesday. And we have to say we thought it was going to be a historically significant election because we could have the first female president, but it was actually historically significant for other reasons. Populist president elected, conventional wisdom with the pollsters and pundits really was all wrong. But I think the biggest significance is really the impact of that rural vote. We also, for the first time, have a president that has never had any political or military experience, and that is the first time in our country's history that has actually happened. Let's look a little bit more at the rural vote and the importance of that. This is a headline of the Wall Street Journal the day after the election that pretty much sums it up. President-elect Trump gained some significant ground and overcame some of the areas that he did not do so well in, as maybe a few suburban areas and urban areas, but really was able to gain very significant ground in rural communities. Rural America did speak loudly. And according to exit polls, Hillary Clinton lost the rural vote by a margin of 3-1. According to people inside her campaign, she believed that if they were able to not lose by such a significant margin, maybe more of a 2-1 margin, she would have won the election and the outcome would have been differently. they're placing the election in large part purely on the rural vote. Is that entirely the reason? Probably not, but there's absolutely no doubt at how significant the rural vote was. You know, rural America makes up 20 to 30% of the population. Yet according to exit polls, the electorate made up 17% of the electorate was made up of rural Americans. That's an absolutely astonishingly high rural vote. Oops, hard to hit on these little arrows. There we go. So what are we going to do now with this? How can we capitalize on this, on the power of rural and this small vote? Well, no matter what side of the political aisle that you sit on, we really have to all get together and fully engage on how we can capitalize on this new momentum in rural America. I think we do have a very significant, as Andrew was saying, opportunity both on Capitol Hill and with a new administration. The debate in this administration, and it will be at times a controversial debate with Congress, because what we have are a lot of fiscal conservatives in this Republican-controlled Congress, but there will be significant debate on how to reinvigorate the economy. And there'll be a lot of talk about building up infrastructure and putting jobs back in certain communities. I think that's really where our power is. We need to remind people that healthcare in rural America is the critical component to a vital rural economy. You can't have a rural healthy economy without a vibrant healthy rural economy without a rural healthy community. And obviously, you know, you folks all know the statistics of just the economic importance of a vibrant healthcare system, not only in attracting new business and retaining, but for the overall economic development in rural communities. And obviously, of course, there's the incredible significance on the life-saving skills and just the benefits that it offers, the health benefits it offers to rural America. So that's really our call to action now, is to make sure we can unite on that. Now let's step towards what Andrew also discussed, and what's on a lot of folks' mind is, wow, what happens now with the Affordable Care Act, with Obamacare, with the signature piece of legislation? We know that the ACA did have a significant impact on the election itself. Part of the many October surprises, we've probably never had more October surprises in a presidential election than this year, but part of that was that announcement that there would be significant premium increases, on average 25%. And we've had the incredible steady drumbeat of large insurers who initially agreed to participate in exchanges, but now changed their mind, saying, and this quote just makes me so angry, that it just wasn't profitable enough. So these big insurance companies, who at times in other areas of their business are making record profits, nevertheless have pulled out of markets. And what markets are they pulled out of? In large part, they're the rural markets in America. Well over half of rural individuals on the exchanges do not have a choice on these exchanges. There's only one, sometimes two markets, two different insurance plans for them to choose. And we know that there are a lot of the close Senate races out there ran specifically on the repeal and replace or support Obamacare. And we saw two different different outcomes, both in Wisconsin and in Arizona, as a result of that argument. So there's still a whole lot of questions. I think Andrew outlined nicely what some of the scenarios are out there. We know we do have certain blueprints of what the Republicans do plan as their repeal and replace, and that is the Republican House plan, A Better Way. We also know that President-elect Trump has again recently committed that he does not want to replace anything, does not want to repeal anything, until there is a full replacement in the works, enacted into law and in effect. He does not want anyone to have any gaps in their coverage. We can also certainly anticipate that the executive orders and any actions, including health care actions made by President Obama could quickly go on the wayside. There is a team within the Trump transition team who is looking currently at the many different executive orders passed under the Obama administration and seeing which ones make sense in their view to rescind immediately. Part of our big concern is what is going to happen to Medicaid expansion. And that is all very much a question mark. We know that the Republican plan is to call for block granting Medicaid. There is a coalition formed in Washington, D.C. to fight that. NRHA does have policies specifically that opposes block granting Medicaid, and we're working with a coalition to try to prevent that from happening. What we certainly can envision is that under the block grant, there'll probably be some sort of an analysis of what the dollar amount and the exact formula of what the block grant is, and there'll be certain different comparisons, I would envision, and compared to states that have currently expanded Medicaid. So there might be some type of a waiver system in allowing states to keep the expansion if they indeed expanded. But all this is still something that we really need to watch and fight for. A promising note is Senator Thune on the Senate Finance Committee, a Republican from South Dakota, said he is interested in leading the efforts on the Senate's efforts to both repeal and replace the ACA. The whole other concepts within the ACA, such as the move towards payment for value instead of volume, and all the payment transformations, that is all still up in the air, everything from the accountable care organizations to some of the other types of models. One thing that we can go on is that the recently enacted MACRA law, the physician payment formula that was replacing the sustainable growth rate, certainly has a lot of those value-based payments and merit payments included in that. We know that's something that's strongly supported by a Republican Congress. But we still have a whole lot of question marks floating around the ACA. The other thing, as Andrew mentioned, that we have to remember is that there's some things that are kind of tough. It's tough to repeal a benefit, and that's why, again, it's interesting to note that the replacement, the goal is to have some type of replacement in before a repeal. It undoubtedly is going to be very expensive, just as the initial ACA was incredibly expensive, and that may be difficult for some House Republicans to swallow as well. We might see early items early in January go away. Maybe things like the Independent Payment Advisory Board. There's questions around CMMI, though Republicans support the Centers for Medicare and Medicaid. They just don't like the way it was implemented under this particular administration. One thing that I really want to remind folks on this call of, the incredible importance of the 340B drug program. That has been a lifeline for so many rural hospitals out there. The expansion and inclusion of this 340B drug program for rural hospitals, critical access hospitals, and rural PPS hospitals does have its footprint in the ACA. We need to make sure that if it's repealed, any replacement maintains this very important drug program. The good thing that we have going for it is that it actually saves money, though historically a lot of Republicans don't like expansion of the 340B program, though they're sort of okay with it when it comes to rural hospitals. So what are a couple of the possibilities that they're talking about for repeal and replace? I'll just say this now because it's kind of the news story breaking today, is that there's really two paths for repeal and replace. They could strike down large parts of the law through the budget reconciliation bill. They can actually do that. They may not, as Andrew said, because it's so difficult, but they could actually do that, and there's some in Capitol Hill who want to have that on the president's desk when he gets there on January 20th. But what they would include in that repeal is not have an effective date until there's some type of replacement that is actually passed, and that would be obviously much, much longer down the road. The other possible path is, just as the House of Representatives has done on so many times the past several years, is piecemeal repeal the Affordable Care Act and just slowly erode at different pieces of that. That gets a little more difficult because when it goes over to the Senate side, for really all significant votes in the Senate, you don't just need the majority, 51 votes in the Senate. You really need that magic 60 votes, and it becomes very difficult to get things done there. So what are we fighting for specifically with this new administration? I just want to highlight that we need to start brainstorming and thinking outside of our healthcare box, because I do think that there's other opportunities for us. Particularly, I think there's an awful lot of opportunity to strike down a lot of regulatory issues, and I'll show you the laundry list that we have already sent a letter to the transition team asking for. But also there will be a significant tax reform bill. So we need to start thinking collectively and creatively on how we can help struggling rural healthcare providers by maybe offering some new tax incentives, tax benefits, maybe to help improve workforce or help some of these struggling rural hospitals out there. We have sent this letter, and we're also trying to attach some of these items to a possible health care bill, the Cures Act, that may be going on during this lame duck session, as Andrew mentioned. I don't think any of these are, I'm not going to dwell on these for the sake of time, but these are just common sense regulatory approaches. We don't think legislative action is necessary. We think CMS can do, and we hope that a new administration, who at least is saying they believe in less regulatory red tape, will take us up and repeal and fix these particular problems. For taking things to Capitol Hill, what we hope to do is to, obviously, the budget becomes incredibly important. The president's budget is going to usually submits its budget early in the new session, the first Monday, I think, in February. It'll be early on in the new Congress. Very important to get strong funding for the rural health care safety net. And we saw in the past, even with a more liberal president, President Obama, if we get something negative in the world of rural health care in that first budget out of the chute, it stays in that budget year after year after year, and we end up having to fight those battles on Capitol Hill year after year after year. So we want to make sure that this time the safety net programs are strongly funded. We're working on meeting with the transition team to talk about that, working to make sure state offices are strongly funded, also working to make sure, unlike the Obama budget, there are no cuts to cost-based reimbursement for critical access hospitals. Another thing that we need to make sure, and I talked about the importance of the 340B program, and certainly also the importance of protecting those that have in rural America that have had new insurance coverage under both Medicaid and the rural exchanges. We have to make sure that health care is accessible and affordable for rural Americans, and that's what our fight is going to be on Capitol Hill. We also will look to work with the Senate Rural Health Caucus and House Coalition and look for a changing up of the Our Hope Act to focus on some of these important issues that we are talking about. And we think that with both Senator Roberts and Senator Franken in the Senate taking the lead, and with the great work that Senator Franken has done in his series of rural health bills, that we can kind of package them all up more and really have the Rural Health Caucus step up to the plate, be the leaders in the Senate, and the caucus on the House side to be their leaders and really be a stronger venue, because they haven't as much these past few years, be a stronger voice for rural patients. Part of that issue, again, NRHA is taking, is the crisis we see that sadly continues to grow, and that is the rampant number of rural hospital closures. At the current rate of hospital closures, we're up to 78 now. We're going to lose a quarter of all rural hospitals in less than 10 years' time. And as I said, we know that when vibrant health care is so important to a vibrant rural economy, And as this article said, when rural hospitals close, towns struggle to stay open. We are pushing again the Save Rural Hospitals Act, and we hope that the caucus and coalition will take up that bill. It basically does two things. It stabilizes rural hospitals, stops the massive number of Medicare cuts that have been hitting rural hospitals, and offers a new payment formula, a new rural health hospital funding model. The other thing, and we have to look also optimistically, is, we continue to lose champions on Capitol Hill, but we also continue to gain champions. Here's just a couple of folks that we're highlighting here that hopefully show promise, and we can get in early on with them, educate them, talk to them about the importance of a strong rural health care delivery within their districts or states, and get new rural health care champions. And, of course, we look forward to continuing some of the importance of President Obama's legacy in rural health care. I mentioned the importance of maintaining folks who have lost their insurance company, who have gained insurance under the Affordable Care Act. Hopefully we'll make improvements, and they will continue to get better health care and more affordable health care. But also we have to remember that the White House Rural Council was established under this presidency, and we hope that that will continue in a new Trump administration. CMS, for the first time, is recognizing that it is disconnected in part to rural health care providers, and has committed and made the announcement during last year's Policy Institute that they will form a rural council and better coalesce and listen to the voices of rural health care providers. There's also been significant growth in telemedicine and some of the CMMI rural payment experiments, though certainly we would have liked to have seen more. Hope to see everybody at the Policy Institute. I think this is going to be the most important Policy Institute to date, because what we are going to see happen in really, it could be just the shortest matter of time, is complete changes in rural health care. Maybe possibly the complete undoing of the Affordable Care Act and the immediate quick replacement of something else. We need to make sure rural voice is in there, and it's strong, and it's at the table. The best way to do that is to get you folks engaged and be able there to educate your folks in Washington, D.C. Obviously you can't advocate, but we really appreciate and count on all your wonderful things that you do to educate Capitol Hill. So thank you very much for this opportunity.
Thank you, Maggie. We really do consider the NRHA our strongest partner in making the rural voice louder, and you're such an important part of everything that we do. So thank you for that. Speaking of making your voice grow louder, a couple of things. We just noticed that during this webinar, the Power of Rural was trending on Twitter. So that's a big woot woot for all of you out there who are on social media and helping that message go further. Secondly, this is not just an effort that happens in one day or one day a year, as most of you on this call know. You've given your life to the cause of improving health for rural people. We'd like you to consider how you're going to keep the messages and the work going forward throughout the year highly visible. This is the time to do that. We have an opportunity for you to take advantage of and to pledge to continue your work to improve rural health, and there's a nice video here about that pledge. At the conclusion of the webinar, a screen will pop up and it will ask you to pledge. I'm sorry that we don't have time to take questions right now. I do see one question in the chat, which I'll get to the speakers and back out to Mr. Andrew Brown. Thank you, Mr. Brown, for your discussion. Cassie's going to play the video now. We hope that you have a great National Rural Health Day. We'll start another webinar at 3 o'clock about using data to make small changes in population health. Thank you, Maggie. Thank you, Andrew. John Williams, I'm sorry you didn't get a chance to speak, but thanks for all the work you do on behalf of Paul Render.
You're very welcome.
Thank you for joining us in celebrating the power of rural. My name is Michelle Rathman, President of Impact Communications, and it has been an honor to work with the National Organization of State Offices of Rural Health to increase the outreach and awareness of National Rural Health Day 2016. As a part of our efforts, we've helped to develop the Pledge to Partner. It is now my pleasure to introduce this important initiative to all of you. The Pledge is a way for us to transform National Rural Health Day into a year-long, ongoing commitment to bring collective focus to specific healthcare issues facing rural communities across the United States. We're asking you to begin new conversations about the power of pioneering partnerships, and we need all rural health stakeholders to inspire communities across the country to address and resolve their most challenging population health issues. The Pledge to Partner focuses on 4 key areas, and these are: first, innovation. Commit to developing ideas, programs, and models that continue to transform and positively impact rural healthcare delivery. Challenge partners and community leaders alike to explore new approaches to reach at-risk rural populations, and engage thought partners from non-healthcare industries to help create additional solutions to prevailing health challenges. The next area of the pledge is focused on education. Initiate frequent discussions designed to inform stakeholders about the real issues facing rural providers. Inform those entering the field of medicine about the great and fulfilling opportunities to care for rural communities, and share facts and information about the needs to improve access and outcomes with those who influence policy and the allocation of resources. The next area of the pledge is about collaboration. Commit to forging new relationships that will bring additional resources into the rural healthcare fold. Please invite competitors to become those thought partners, helping to find synergies that result in achieving important shared goals, and then share ideas and resources and information with industry and non-industry contacts, seeking ways to work together in the common interest of rural health and wellness. The last piece of the pledge is all about communications. Use all available channels and mediums to spread the word about the power of rural. Follow, like, forward, post, and pin those stories and ideas and facts and opportunities and partner with all of those who are working to make a difference in rural health care. We're also asking you to really stay connected with NOSOR and your state offices of rural health throughout the year and help us reach the goal of 1 million people in social media platforms leading up to National Rural Health Day 2017. So there you have it. The 4 major areas of the pledge is to innovate, educate, collaborate, and communicate. And it's very easy to take the pledge by visiting powerofrural.org. There's a very simple form for you to complete, and when you hit the send button, you'll start to receive information for the rest of 2016 and into 2017, leading up to National Rural Health Day 2017. And the last thing we're going to ask you to do is, in everything that you do today with social media, please use the hashtag #PowerOfRural. Thank you so much for the opportunity to be a part of National Rural Health Day 2016.
Thanks, everyone. Happy National Rural Health Day.